Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Half an AM, welcome back to Healthy Living Tuesday, everybody. We are talking about the very uncomfortable, in the literal and figurative sense of the word, the topic of gastroenteritis. There are not many of you who enjoy getting that. I would say nobody enjoys getting that. So Dr. Jitka Lom is with ExpressCare, and we are going to talk about this. Dr. Lom, is gastroenteritis the same thing as the stomach flu? Because I understand there's a pretty nasty bout of that going around the island right now, unfortunately.
There is. And to answer your question, yes, in common terms, we call it stomach flu. Vomiting and diarrhea, sometimes with a fever, sometimes with a little runny nose or cough.
And what typically causes that? Because some people say they're like, oh, like I ate eggs that may have been sitting out, for a lot longer than they have, or, I drank juice which kind of smelled funny and I just took a chance and everything like that. Is that different than a viral flu that's being passed around, like people in the office just, exchange airborne?
It really is. So the viral stomach flu that we're talking about is passed from hand to mouth. People will cough or put their hands in their mouth and then touch something, and then you'll touch it and you'll pick it up that way, and you'll get basically vomiting and diarrhea without having eaten any bad food. On the other hand, if you eat some Kelaguen that's been spoiled or some food that's expired or whatever, then you may get more like food poisoning, which is due to usually bacterial toxins that have been sitting in that food for some time, bacteria that have multiplied, whereas what we're talking about here is a viral illness. Okay,
well, for people that, unfortunately, if you have it right now, our sympathies are with you, and hopefully we'll try and give you some helpful tips. So if people have the stomach flu right now, what can they do? Because, it's easy to say, well, just, get lots of rest, get a lot of fluids, but, if you've got severe stomach cramps, and it's really not that easy to do to rest.
No, it's very difficult. So the main thing is try not to eat, because when your guts are speaking to you in this way, they're trying to tell you to lay off the food. So sometimes people feel that they need to force food. You really don't. Just drink lots of liquids so that your urine is clear. Otherwise, as far as foods, only eat if you're very hungry, and then you would stick to very bland, boring foods like crackers or a little bit of rice or a little bit of broth, a little bit of Jell-O, those type of things. Of course, for children, we have to make sure that they're hydrated, because they dehydrate even more easily than adults, and also the elderly. So most of the time, people can handle this at home. Occasionally, they'll get, like you said, very severe cramps, and they need medication. And if so, it is available. You can get medication both for cramps, for pain, and for the diarrhea, and also for nausea or vomiting, where you could get an injection or a prescription to help you calm those symptoms. But most of the time, stomach flu will last 2 or 3 days and resolve on its own.
Is it possible, medically speaking, to have what a lot of people say? They're like, oh, I've got a strong stomach, or like I've, I can eat whatever I want, or even if I've got like a stomach flu, I can just.
Well, actually, that's a great question, and it actually is true, because, for example, there's the example of cholera. Cholera occurs more in undernourished populations and poor populations, where people will get basically a severe gastroenteritis. That's what cholera is. And what we know is that if you have a strong stomach acid, you'll basically kill off and burn off those bacteria when they're going into you. The same may or may not be true of viruses, I really don't know. But in general, if somebody is very strong and fit and has good stomach acid, they will be more resistant to getting gastroenteritis.
So having strong stomach acid is a direct byproduct of taking care of yourself and working out.
Of eating healthfully and avoiding alcohol and cigarettes.
Not a lot of people would know that, I think. They would think that, oh, you've got more stomach acid, that means, like you're actually living very poorly.
Oh, yeah. Well, actually, if you think about it, our stomach acid is very, very helpful, and it's the second part of our digestion. First part is our saliva. The second part is the acid in our stomach and the grinding action of the stomach in digesting the food. And you need that acid there to help dissolve it and break it down, especially the proteins. And so when we're children, we usually don't have any stomach problems, right? Most kids eat whatever and they're fine. They don't have digestive issues. That's because they have a very healthy constitution, and they have a strong stomach acid. Strong meaning their pH is basically around 1. And then as we get older, the glands in our stomach actually become weaker, and some of those lifestyle factors affect that, like smoking and alcohol and so on. But just in the process of aging, our glands will produce less stomach acid. So if you take the average elderly person, they will have a much higher pH, meaning less stomach acid than a young child. And so their digestion will be difficult, they'll be more sensitive, and you can actually take stomach acid supplements, which they offer at different vitamin stores, where you can actually take a little bit of stomach acid with your meals if you're an older person.
Okay, now for these symptoms, before we go to commercial break, one more question. Obviously, if you've got, you don't even have to say severe nausea, because any nausea is very, unwanted, or diarrhea. What types of over-the-counter medication should one take? Because I mean, it's the most uncomfortable you can be when being sick.
Nausea is a horrible feeling. There are some over-the-counter medications for motion sickness that you could try for your nausea. And obviously, this is not if you're pregnant, okay? But there's dimenhydramate, which you can pick up over the counter. I'm trying to think of the generic or the trade name, but if you just look for products for motion sickness, that will usually help you for nausea. As far as other medication, Tylenol, if you're experiencing pain or cramps, stay away from Motrin or Aleve. Those ones will make you worse in general because they'll rip up your stomach lining. So Tylenol and something for motion sickness, but mostly lots and lots of fluids. And a question people often ask me is, how can I drink fluids when I'm so nauseated I want to vomit? But you always keep something down. You may vomit, but something that you have drank will usually remain down. So the balance will be on the positive for you if you keep drinking.
Even taking Gatorade because you want to replace your electrolytes?
Sure, Gatorade's a great idea for children. Pedialyte, that's a great idea.
Okay.
Avoid milk.
All right. Yes, avoid milk, and absolutely. Okay, well, we have some really interesting viewer questions from this, so stay tuned, and you stay tuned over there in TV land, because we will be right back. Dr. Lom is with us when we return.